Okay. Is it different from all the, is it the same link with all the other people joined? Okay, okay.
Okay.
Dr. Downs, we are good.
Yes, I see we have Dr. Mccrary here now. I just wanted to basically introduce Dr. Mccrary here. And so let's see. All right. Let's just get started here. All right. So, all right. All right.
So,
Yeah.
Good morning, everyone. Yeah. Welcome to the 7th Annual Women in STEM Forum. I'd like to introduce the moderator of the event, Dr. Damon Downs,
All right, thank you.
who's going to be moderating the event this morning.
Yes. So what I wanted to do was introduce, Dr. Mccrary. So Dr. Mccrary, he's Vice President for Research and Graduate Programs at the University of the District of Columbia, leads the growth, development, direction, and oversight of the university's research enterprise. He has held similar research leadership positions at the Johns Hopkins University, Applied Physics Laboratory, Morgan State University, and the University of Tennessee. He is a change agent and serial innovator responsible for developing comprehensive, sustainable research strategies, fostering transdisciplinary research, and expanding research programs via engagement with federal and state agencies and private entities, including his significant contributions to Morgan State University, becoming one of only 130 universities nationwide to have an R2 status in the Carnegie classification of institutions of higher education. Dr. Mccrary served 2 terms as the national president of the National Organization for Professional Advancement of Black Chemists and Chemical Engineers. He is a fellow of the American Chemical Society. He received his doctoral degree in chemistry from Howard University, a master's degree in engineering management from the University of Pennsylvania, and a bachelor's degree in chemistry from the Catholic University of America. Dr. Mccrary has authored and co-authored more than 60 technical papers and co-edited 2 books during his career at AT&T Bell Laboratories and the National Institute of Standards and Technology. He has received numerous honors and awards, including co-recipient of the U.S. Department of Commerce's Gold Medal in 2000 and the 2002 Percy Julian Award. In 2011, he has honored a Scientist of the Year by the annual Black Engineer of the Year Award STEM Conference in 2014. In October 2016, President Barack Obama appointed Dr. Mccrary to serve on National Science Board, which oversees the National Science Foundation. So welcome everyone, the renowned Dr. Mccrary.
Thank you, Professor Downs. And I want to thank both you and Professor Bushra Ahmed Saeed for opening remarks to this. This is the 7th annual Women in STEM. And when I was invited by Dr. Saeed to the first conference a few years ago in 2019, I was astounded by so many young and talented women who were looking to go into science, technology, engineering, and mathematics. And I wanted to just say that right now, if you all know what Halley's Comet is, you all are at a Halley's Comet moment in terms of the demand for STEM workers and the focus on our historically Black colleges and universities like the University of the District of Columbia. As you know, we have a vice president who is an HBCU graduate from Howard University, and she's also a female. And even though her degree is in law, she graduated in the same class I did with my PhD in 1986 at Howard University. She's in my yearbook, and she studied economics, and she had to take some STEM courses in order to pass that. And so it's really a great time, as you know, to be a female and to be a female of color to go out here in STEM. And if I could just take a moment, and if I could share my screen, one of the things that I wanted to show you was that kind of thing is in all of is kind of in my DNA. So hopefully you'll be able to see this. If not, just let me know and I'll unshare it. Mr. Downs, is it coming up? Okay. So it's probably not sharing right now. But one of the things I wanted to tell you was that my mom was a STEM pioneer, even before STEM was STEM. She was one of the, I think it's coming up now. And let me see. Tell me if you can see that.
Not the complete view, but I can see that you're sharing. You're attempting to share. But there it is now. I see it.
All right, and it should come up in the right mode in a minute.
We see it now. Thank you so much.
Oh, okay. And let's see if this will come up in slide view mode. Okay, there you go. So she was from Philadelphia. She joined the Army Nurses Corps. She was a first lieutenant. She was a group of Black women who went to Fort Clayton, okay, and they were looking for a better way. And there was no BSN back then. She just came out of high school when she was 16 and joined the Army. When she got back, she had a job in the government. And of course, at that time, that was the late 50s and 60s. There was a lot of discrimination. And they said, well, if you want to make more money as a nurse, you need to have a bachelor's degree. And so she said, okay, that's not going to stop me. So she went and got that and then got her MS in urban planning. But she worked as a psychiatric nurse, okay, and worked for the federal government for many years, worked at DC General, worked at Area B, Spring Road. She met my father so she was also a trailblazer. I mean, you're going to marry a white man in the 50s at that time. That's kind of crazy. But they got together, fell in love. He was in the Army Transportation Corps. And he was what we call blue collar STEM too. He didn't have a degree, but he did a lot of engineering work and was stationed at Fort Eustis. And at that time, we had to live in DC because they had miscegenation laws. So we couldn't live in Virginia. And so let me see if I can get this to go one more time. I think this is kind of locked up. But one of the things I wanted to show you was that a trailblazing woman like herself went on and did not let things stop her from what she had to do going forward. So I'm going to stop sharing this for a minute and go back and talk about then, she went on and got her degree. But also I want to tell you who my hero is, and I couldn't show it here on this platform, so excuse the technical difficulties. But my wife, her name is Mercedes Benitez Mccrary. She's a captain in the public health service. She's a speech pathologist. And last year, she won one of the Women of Color awards that was offered. What I'm trying to say to you all, it is a great time. Now's the time to take advantage, and UDC is the place, okay? And I want you to say to you all that because right now, because if we look at the demographics, the country will be minority majority in the next 10 years. They're looking for you young women to get in these fields. And also for the faculty that are there, I want to give you my commendations for supporting that. Right now, in some of the health fields, you can start out with an AA degree making $60,000 to $75,000 a year. There is such a great demand as what the pandemic has shown. I will tell you right now that there's only one person that can stop you from getting your dreams. And that's the person you see in the mirror, okay? Because you have the benefit of being around some great faculty. Because our mission here is obviously not to make money, not at UDC, okay? Our mission here is not to collect a lot of accolades. Our accomplishment is when we can go home at night and we can say, you know what? I saw that student get off the stage. She was like my mother who left the Army, had a couple of kids, went back on a full-time job and got a degree and made a difference, okay? Our dream is when we sit back and I talk to Dr. Saeed or Professor Downs and they say, that young lady that came through, she's now the vice president for engineering at Lockheed Martin. Or she can be like Euphemia Haynes, who you may not know that name, but she graduated out of UDC back in the early 1900s. It wasn't called UDC then, but it was UDC. And she was the first Black woman in the United States to get a PhD in mathematics at the Catholic University of America, university where I got my bachelor's degree. So when I look at all of these people, the only thing I want to tell you all is you have a legacy that's behind you and a legacy you can make. You have many women who have marched and died, shed blood, so that you can be in this position. Both Black and Latino women, okay? Latino women, all right? So there's nothing that could stop you. And the only thing I ask for your legacy going forward, because I know I'm going to read about all of you all in the next 5 or 10 years, and I'm going to sit back with Dr. Saeed and I'm going to say, you know what? I know that person, just like in my yearbook is Vice President Kamala Harris. I said, now I just have to be able to get their autograph, okay? Because all of these women are very famous in making it. So please take advantage of all the resources UDC has. Don't be afraid to ask a question. You can email me. You can email the professors, Dr. Saeed, Dean Hamilton, anybody about how you're going forward. And just remember, when you get to that place, which you all will be there, help the young ladies who come behind you. Make sure you open that door and give them a hand. Because when you have those blessings that come to you, you need to give them too. And just one final thing. Just remember one thing. If God be for us, who can be against us? It is my pleasure to open this 7th annual Women of Color in STEM conference. Again, my congratulations to both the organizers, to our dearest faculty to make it happen, and to you all as students. And thank you very much for this honor to open this. I am humbled, and I thank you very much.
Thank you so much, Dr. Mccrary, for the encouraging words. I just want to remind, I think I have the understanding that he's also an avid and dedicated Redskins fan. So that's a major thing. So, as far as perseverance, no matter what happens, you stay loyal. Very good. All right. So I want to introduce the next speaker. Now, thank you so much, Dr. Mccrary. The next speaker we're going to have is Dr. Donna Austin. Let's see here. Select the share. All right. Right. Okay. So, Dr. Donna Austin, she's a certified funeral service practitioner and mortician with Freeman Funeral Services, and that's Clinton, Maryland. Dr. Austin has served in the funeral industry for over 40 years, holding a funeral license in the states of Maryland, Washington, D.C., Virginia, and North Carolina. Her commitment to funeral service allows her to educate families about the importance of and end-of-life preparations, with over 20 years as a pre-arrangement funeral planning counselor. Dr. Austin is known as a Renaissance woman, having a myriad background of experience from serving in the United States Army as Memorial Affairs Specialist, who later graduated from Virginia State University, receiving her bachelor's degree in chemistry, working for several pharmaceutical companies. She also had a body transport removal business while serving as an independent contractor for several funeral homes in the Washington, D.C. metropolitan area. After Dr. Austin received her master's at the Catholic University of America, she decided to pursue her doctorate. She recently graduated with her doctorate in business administration from Walden University, specializing in family succession planning, as she realized that many of the corporations were taking over the small family-owned funeral businesses, particularly in the African-American communities. Dr. Austin is a published author, currently writing about the funeral industry as it pertains to funeral planning. She is a member of 100 Black Women in Funeral Service, and TAPS organization, which provides bereavement camps throughout the United States for family members and children who survive the loss of a parent or spouse in the military. Other organizations include the National Funeral Directors Association and her university alumni associations. While presently working at Freeman Funeral Services, she stresses the importance of what is needed to provide a decent service while maintaining dignity and not stress about trying to please others. Her long-term goal is to leave the funeral profession as a much better place to work by educating others coming into the industry. So I want you all to welcome the esteemed Dr. Austin. All right.
Thank you so much for that introduction. Greetings, everyone. I want to thank you all for inviting me because I'm honored today to be here for the opportunity to be able to speak before you. What I'd like to talk to you about is what's really close to my heart is serving others. Serving others, and we have to understand, what does that mean to serve others? As a funeral professional, we must understand the importance of helping others in a profession that deals with emotions and various grief stages, which is part of the death process. We must be able to identify those stages of grief because we serve others, and we have to navigate the complexity of emotions. We must put other individuals before ourselves, and remember that if we live long enough, every one of us will experience the suffering others have gone through. I became interested in the funeral industry at the age of 12 after losing a great-grandmother. And it was my first experience with the funeral industry because what I realized, I didn't recognize my granny. She did not look like my beautiful granny, and this is where my curiosity led me on my life's journey. I made it my mission to find out why my granny, who was fragile and a fair-skinned woman, turned dark and she was bloated. So at the age of 16, I began working in the funeral home. And by the time I was 18, I had enrolled at the University of the District of Columbia in the mortuary science program under the direction of the late Leander Coles. But because of an unsuccessful marriage, I decided to move to California, and I finished my education in mortuary science, graduating from Cypress College. After a few years, I decided to further my education. Therefore, I enlisted in the U.S. Army to pay for that education, and I served in the Quartermaster Corps as grave registration. In the military, I served in U.S. mortuaries in Frankfurt, Germany, Panama, Saudi Arabia during Desert Storm, and I also worked as a pathology assistant with the State of Virginia Medical Examiner's Office. Having graduated, I decided after 10 years of active duty in the military, I decided to go to the Virginia State University, where I just received my degree in chemistry at the age of 36. I have been a professional student my entire life, navigating experiences as a wife, a single mother, and a grandmother. However, I learned 3 things over my lifetime, which allows me to make a difference and continues to help me reach the goals that I've set for myself. Those 3 things are discipline, emotional intelligence, and customer service. Discipline is the practice of learning to obey the rules and a code of behavior. Discipline is necessary because it allows the mind to have the power and the strength to overcome procrastination. Discipline is about action, by doing the task and achieving the goals you set for yourself. Discipline is crucial for organization, punctuality, efficiency, consistency, and allows you to focus on that task. I once heard a quote, "The more disciplined you become, the easier life gets." To quote Abraham Lincoln, he said, "Discipline is choosing between what you want now and what you want the most. Therefore, it is up to you to decide." Next, emotional intelligence. It's about learning emotional intelligence because it's necessary to have the ability to understand, use, and positively manage your emotions. You must learn emotional intelligence because it is essential for communicating with others, overcoming stress and life challenges, and resolve conflict. Emotional intelligence is having empathy and being socially aware of another's emotion. Daniel Goleman tells us that having emotional intelligence allows you to be able to give and receive feedback, deal with the challenging family members and customers, navigate change, and most of all, work through the setbacks and the failures. And most of all, customer service. Let's talk about customer service, because customer service is the support that is offered to that customer. What does it mean to serve others? It's to put other people's interests above your own through your actions and your words. Be consistent, be accountable, ethical, and take responsibility for your actions. Jackie Robinson once said, "A life is not important except when it has an impact on other lives." To serve others leaves a profound effect, and it provides an opportunity to make a connection with another individual. Life is about relationships. Funeral service is about relationships. Our business is a referral business. And I always say, never pass up the opportunity to serve others, because when you have satisfied another individual's need, during sadness and grief, that customer will give you another chance to serve their family again. Don't make promises you can't keep. And yes, answer the phone. We live in a world of spammers and telemarketers, but we never know when we're going to get that death call. So let people know that you do respond. Be helpful and learn to deal with complaints. They help improve your business by becoming a problem solver, and go that extra mile. And finally, know the difference between hearing and listening. Hearing is one of your six senses, but listening is an art. Learn to listen with compassion. Understanding a person's pain and suffering by serving others can lead to a more profound healing for the customers that you serve. I just want to say that I'm really grateful because I've come full circle, and I've had my opportunity now to impart 42 years of experience and knowledge to the next generation. And as an adjunct professor with the University of the District of Columbia, I just love what they have to offer. In the mortuary science program here at the District of Columbia, University of the District of Columbia, it's a fully accredited program from the American Board of Funeral Service Education. And graduate students are eligible to sit for the national board exam as a step towards obtaining a funeral director's license. We have faculty that have numerous years of experience in both the field and in teaching. And you can find our information at udc.edu by clicking on the program tab menu and scroll to mortuary science. All the information on our program is found there. And the program is a 1-year prerequisite course and 2 years field of study. So the courses include funeral service management, funeral service directing, embalming, restorative art, and we have laboratories where embalming procedures are performed in our facilities. And also there are plenty of jobs in the funeral industry, because you look at not just being a funeral director, an embalmer, a mortician, which is a combined license, but there's also opportunity to own your own mortuary transport business, working with the medical examiners in the area to become an autopsy assistant. And like me, being an adjunct professor, also there are military jobs under the mortuary field. And just to let you know, the salary ranges can range anywhere from $45,000 to $130,000, but it may require you to relocate somewhere to another area. But most of all, it's a great opportunity. And if you're about serving others, we would be happy to have you at our mortuary science program at the University of the District of Columbia. Thank you.
Thank you so much, Dr. Austin. Incredibly salient points as it relates to that marriage between business and science. Thank you so much for bringing that. Sometimes we overlook that, those who are interested in the science, but now this is this aspect you should look at as well as it relates to the business aspect of things. So thank you so much, Dr. Austin. And of course, I'm pretty sure that they've heard clearly when they heard those salaries there, Dr. Austin. Yes, please make sure that you consider things now a little bit differently related to whatever avenue you take. It's something now that's extra you can consider. Isn't it great when you have other opportunities out there? Yeah. So let's keep that, make that well noted. Thank you so much, Dr. Austin. What we're going to do now, guys, is we're going to do a very interesting aspect of our actual forum, which is to actually present some incredibly accomplished woman of STEM, okay? And we're going to do that by having a panel and looking at a panel. I'm going to actually introduce the panelists now, all right? And what we're going to do is start with, let's see if I can share that. Yes, okay. Start with Dr. Angela Washington. So let's see here. So Dr. Angela Washington, she's a nurse practitioner in the orthopedic department at the Baltimore Veterans Administration. A lot of people just say VA, right? She graduated from Hampton University in 1988 with a Bachelor's of Science in Nursing and worked as a registered nurse in several medical surgical floors, intensive care units, emergency departments, and primary care in Baltimore, Maryland area. After graduating from Bowie State University with a Master's of Nursing in 2000, she began working as a board-certified family nurse practitioner at Johns Hopkins University, and then her current position at Baltimore VA Medical Center thereafter. During her journey, she became the lead orthopedic nurse practitioner and earned a Doctor of Nursing Practice degree. Dr. Washington is fortunate to have the opportunity to use her expertise as a nurse practitioner, healthcare professional to address the needs of the veteran orthopedic population and continues to provide and implement quality improvement projects at a developmental and organization level. She is a published author of her doctoral study titled Management of Post-Operative Pain in the Total Joint Replacement Patient, and has been an expert speaker on orthopedic topics for several professional conferences in the DC, Maryland, and Virginia area. I want everybody to please welcome the commendable Dr. Washington. All right. Next who we have is Dr. Tracy Davis. Dr. Tracy Davis. Dr. Davis, Tracy Davis, is the director of pharmacy at AmeriHealth Caritas, DC, which is managed care organization in the DC market. AmeriHealth DC works to innovatively service their members through integrated healthcare and member-driven services. As director of pharmacy, Dr. Davis holds responsibilities as the pharmacy liaison to the state, collaborator with the medical director, case management, and the executive team to reach health plans' quality goals, community outreach, and oversight of the PBM. Dr. Davis specializes in policy development and change management. She is a passionate pharmacist with an extremely diverse background. Over the last 18 years, she has worked in hospital, retail, and managed care pharmacies, and also for a government health plan. She obtained her Doctor of Pharmacy from Howard University and has also earned certification in medication therapy management and completed a general practice residency in 2004. She believes that evolution requires us to aspire to be more. Dr. Davis currently lives in Maryland, where you'll find her playing golf or teaching yoga. She also delights in taking her children to the park. And although she mentions golf as more like a hobby, but we know some business transactions occur at the 9th hole there, right, Dr. Davis, maybe, okay? All right, so everyone welcome, please. Dr. Davis, please, to our All right. Okay, next is, let's see. That's Miss Marilyn Matthews. Miss Marilyn Matthews is a mental health therapist. She's a licensed clinical professional counselor working with, but not limited to, children and adolescents. Ms. Matthews earned 2 master's degrees from Washington Adventist University in counseling, psychology, and clinical mental health counseling. She is currently working on a 3rd master's in healthcare administration. Her experience began with an internship at an outpatient mental health clinic in Maryland, where she continued to work after obtaining her license. She enjoys membership with the American Counseling Association and Psi-Chi Honor Society. Marilyn's academic journey took her down a different career path to where she is today. Marilyn's formal education began in her home country of Guyana, where she obtained a Bachelor's of Science in Medical Technology. Before migrating to the USA to pursue advanced studies, all right? Because of her love for sciences and her passion for helping others, she was impressed to pursue a degree in medical technology, a field she worked in for over 15 years. The experience gained prepared her for work in several areas on campus while pursuing her master's degree, including adjunct faculty for microbiology labs, psychology tutor, and student professional. During her work as a medical technologist, she received an award for Medical Technologist of the Year in 2000. In 2019, she received Washington Adventist University School of Graduate and Professional Studies Graduate Clinical Award. Marilyn is passionate about service to other and volunteers in different areas of her church, as well as advocating for needs of her clients. She attributes all of her success to God and the support of family and friends. She hopes in the near future to pursue a doctoral degree in psychology, specializing in neuropsychology. Please, guys, if you can all welcome Miss Marilyn Matthews. All right. Excellent. And next, we have Dr. Kali Gordon. Dr. Kali Gordon. Dr. Gordon's desire to become a physician dates back to her childhood, from admiring her pediatrician to serving as a candy striper at a local hospital. Several factors influenced her career trajectory. She received her bachelor's degree in biology from Howard University before getting a master's of science with a focus in neuroendocrinology from Georgia State University. This led her to medical school, and she earned her degree at Morehouse School of Medicine. After medical school, she matched in the competitive and prestigious institutions of Jefferson Health System, internal medicine, and in Yale New Haven Hospital, anesthesia. Later, Dr. Gordon returned to Georgia and Morehouse School of Medicine for additional training within the public health and preventive medicine residency program, which encompasses population health and occupational medicine. In 2002, Dr. Gordon was one of only a dozen candidates selected to take part in a unique international family medicine rotation in Pinar del Rio, Cuba, through the medic program at Emory University. She worked with Cuban physicians in community clinics, utilizing traditional and alternative and holistic medical treatments. Dr. Gordon has had a broad career path that includes international travel with patient care, corporate health roles as chief medical officer, medical director, and site director, occupational health, urgent care, and pain management. Her focus and interest in pain management began during her anesthesia residency at Yale. Residents were assigned patients via the chronic pain clinic, and Dr. Gordon attained a newfound perspective. I learned that pain is far more than just an external feeling, she explains. Pain can invade every aspect of one's life. It's your body's way of speaking and asking for help. Each patient and remedy differs. Dr. Gordon compares treating pain management to solving a puzzle. Multiple factors create pain symptoms, she says. After thoroughly analyzing a patient, she puts the pieces together and formulates an ideal plan of action. This includes unique suggestions, including journaling to help pinpoint the timing and accurate details. Patient care is important, she says. I try to relate to people, meet them where they are, and be a good listener. I truly care, and my goal is their healing, right? She's a member of the professional organizations such as American Medical Association, AMA, the American Society of Anesthesiologists, and the American Public Health Association, the American College of Preventive Medicine. Okay, and what does she do in her spare time? Well, she's an AKA, all right? And alumni organizations, mentoring, reading, exercise, fitness, arts and craft, and spending time with family. I want everyone to please welcome the incomparable Dr. Gordon. All right, and please, if everyone can re-welcome again to the panel now, though, Dr. Donna Austin. Thanks again, Dr. Austin. Appreciate that. Okay. So what we want to do now is let's go ahead and start a discussion because I know there's quite a bit of information that this panel, incredible panel that we have before us today, followed up with health, by the way, which is something very, very important considering this COVID-19 crisis that we're in right now. And so it'd be very interesting to see a lot of different perspectives from all the way from when people started, what's going on with the profession, how COVID-19 is involved with this, and everything surrounding that. So let's get into it. All right. I want to ask actually a first question for everyone, actually, because it's so important. And that question is, well, and I'll start with you, Dr. Washington. All right. What impact has COVID-19 had on your profession there since the onset of this pandemic?
Thank you, Dr. Downs. And I feel honored to be a part of this event and just to be able to speak to those who may want to become a nurse or aspire to be a nurse. So I just feel very honored with that because I've been a nurse for over 33 years and I've always inspired and empowered. So hopefully I will be able to touch someone today. Well, I'm going to speak of the impact COVID-19 on my current position, which is a board certified nurse practitioner. I work in the specialty of orthopedics, and I do work in an outpatient clinic setting in a hospital, the Veterans Administration, and I've been there for almost 29 years. But I've guided, because of the COVID-19, I've had to guide changes in my practice based on the medical center's changes. And in March of 2020, when COVID-19 hit, all the outpatient clinics were closed. All of our high priority patients that included fractures or those that required surgeries were being seen in person. They were able to come in as long as they did not have signs and symptoms of COVID. Only patients requiring emergency services were allowed to come to the emergency room, but no visitors were allowed to see their loved ones while they were in the hospital. Now, I work in an orthopedic environment where many older patients have chronic conditions, arthritis. And with that, sometimes people have mental conditions like maybe dementia or just difficulty getting around. I'm used to family members coming with them, and I can kind of learn a little bit more about their life and the things that they need. I was not able to do any of that when COVID hit because we had to transition into telemedicine. Telemedicine where we did phone calls and video calls. So telemedicine offers doctors and nurses a glimpse into personal lives of patients, which can help them better understand, we can better understand their environmental factors that impact their health, but it's really not helpful as much in orthopedics because if we need to do a physical exam or give an injection to help with their diagnosis, we can't do it. So it's kind of been a challenge in the orthopedic world for us, but we are working with it. My compassion and my communication skills that I've developed over the past 33 years have really helped to keep the patients understanding the process, when they can start coming back in, giving other alternative treatment modalities for them, and that actually helps satisfy them. But we also had to do quick training on computer equipment that we will be bringing home so that we could do the telemedicine, continual virtual Microsoft team meetings so we can be up to date on what's going on in the organization, so we can provide safe care. And we just had to be creative in seeing our patients because we have to keep the hospital open. We have to keep the hospital continuing to make money. So we had to be productive. We had to be efficient. So there were nurses that were detailed to other areas. So that was the main thing. The PPE, that was difficult as well, trying to have to wear double mask and the gowns when we saw patients, but we quickly got used to that. I got used to that. So that pretty much is how we are now. I'm functioning, still doing telemedicine.
Excellent. Thank you so much, Dr. Washington. And it's very interesting your take on, you would immediately think with the use of technology, like you mentioned, with telemedicine, that there might be some obstacles, but you brought up the benefit, a benefit related to finding a little bit more out about, and as we know in medicine, it's the history is the main, very, very important piece to management and finding out what's going on in their environment and with family members. Wow, that's very interesting there. Yeah, how about I ask Dr. Davis, same question. Has there been an impact, if you will, or if you can expound upon any impact that COVID-19 had since the start of the pandemic for you?
Yes, thank you for this opportunity to share. So as a pharmacist, I'm connected to pharmacists that work across the spectrum in many different ways in our community. So for our community pharmacists, this was a huge transition because they were expected to be there every day. So where other people were in clinic settings and they were able to kind of back off and do telemedicine or even close for a week or so to maybe figure out a game plan, pharmacies just can't close. It's illegal for us to close a pharmacy. So it was devastating. I mean, while other people are out looking for toilet paper and able to go to the grocery store, we're still working a 10-hour day, and people still have the exact same expectation of the same sort of service, and that, you know, you're not going to be overwhelmed too. And then you go home to a family that's uncomfortable. They don't know what you may have been exposed to. And then you find yourself not able to provide basic things for your family because you haven't been able to go out and do those things for your family. So that was a horrible, very challenging transition. It made a lot of people really consider, do I even want to work in this capacity? I think a lot of people consider healthcare because they think of the money you could earn, but they don't really consider when they're very young that we run toward the fire. That's what all of us do. We are not the people that get to stay home when things are going bad. So, you know, that I think is a gut check, you know, for us every single time, like, well, you know, who am I really and why do I do this? And I think, you know, in general, yes, the money is good, but you start to question, is it that good? So in my particular role, because I work for an insurance company, I wasn't on the front lines, but I was definitely receiving the calls day to day from my friends in the community. So from our perspective, because what I do is policy development, I'm taking the requests that are coming from the district it seemed like every single day in the beginning, of how we will change the benefits in our health plan to make sure that we're accommodating so that we can make it work. So where we might have had like 2% telemedicine visits before, now 70% of our visits are telemedicine visits. So we had to make sure that our benefits aligned so that when patients showed up, wherever they were going to show up, that they could still get everything they needed. So one of the other things we had to do was extend benefits. So where we might have had products that were not available as a 90-day supply before, we shifted those to make them so patients wouldn't have to leave the house so much. Where we had prior authorizations that were required for patients to get products like Suboxone. I'm sorry, that's not me. I don't know what that is. Maybe Damon, go on mute. Okay.
It's fine. You're fine.
Where people needed products like Suboxone, which is something you use when you're a heroin addict as a medication to keep you from using street drugs, we took away those prior authorization requests so that those patients would be able to just get the medication. We did not want to be in a situation where we were putting the guidelines above patient care. So there were many changes that we made over the course of those first few months that are still in place. Everything in DC will be in place until the mayor lifts the state of emergency, and then it still extends 60 days past then. So we're constantly just looking at our benefits and trying to make sure that our patients are able to get access. Another project we did with a local pharmacy was to make sure that we upgraded all of our patients' blood pressure monitors and diabetic monitors so that those data points could dump into the doctor's electronic medical record. So those kind of things were like, if you're going to have an effective telemedicine visit, you kind of need some data. So those are the kind of things you do on the policy side to make sure that things will go smoothly for your patient population.
Thank you so much. I'm just curious, based on the different processes that you've been put in place to make sure that there's no equity issue, and as it relates to who gets the medicine, have you seen good results based on those changes that you guys have made?
We are
With
still in
everybody
the
getting what
process.
they need. What's that?
We're still in the process of looking at outcomes. Typically, in our field, we typically like want 180 days of a washout for claims to kind of go back and forth before we really would consider that to be good data. And so obviously all the data from 2020 is skewed because a lot of patients stayed home, you know, and where we are very concerned about what's going to happen in the next 2 years because so many people haven't had care and they're going to come back in way sicker. We would have been able to catch things faster. All the diagnostic tests that got put off, all these things are very concerning to us. But one thing I want you to consider when you think about the pandemic and our community is when a doctor's office says you can't come inside, then as a mother I have 3 children. So if I happen to have to take one of them with me to the doctor, now I am on the bus with one of my children, which is already stressful because my child won't keep their mask on. Then I get to the doctor's office and they tell me to stand outside. Well, we had a winter. It was cold outside. So now I'm going to stand outside with my child waiting for you to text me on my phone to tell me to come back inside. How likely is it that you're going to put you and yourself through that experience for a follow-up visit for your blood pressure or your cholesterol or your diabetes? And that's kind of where my heart always sits with. This is our patient experience. So as much as the protocols make sense, COVID definitely put us in a position where we know people are just not getting care.
Thank you so much, Dr. Davis. So poignant. How about you, Miss Matthews? Miss Matthews in mental health, especially mental health, right?
Yes.
What, if you will, any changes or how has COVID-19 impacted your profession since the onset of the pandemic?
Yes. Thank you so much, Dr. Downs, for the opportunity to share. So in my field, traditionally, therapy is offered in person. And so you can imagine with the changes with the pandemic, we had to switch to all virtual. And so there was some telehealth offered before on a smaller scale, but generally it's offered in person. And so when the pandemic happened, there had to be some quick adjustment for those of us in the profession, as well as the clients, which I believe was more difficult for them because clients are used to having that, what they consider a safe space in the office. And so transitioning to telehealth was a difficult process. Initially, there was some resistance on some of them, some parts, some had doubts, but they eventually realized as the pandemic prolonged, we recognized that there was an increase in clients seeking services, and we can all imagine why. Because of the pandemic, there was a significant increase in the clients seeking services. But over the period of months, most of the clients adjusted well because they needed that service, but couldn't do it in person. So for the most part, there was some adjustment, but there is still that reservation in some minds that the space is not that safe because they have to do it from home or wherever they are, and so that poses some limitation in that aspect.
You would think that based on COVID-19, the issue and the mental stress that related to that, all the family issues, the employment issues, that you would have an increased rate, but we have the obstacle related to technology. And you're concerned now about certain patients being able to be compliant. So has there been a compliance issue that you noticed that was quite significant or not?
As I said, initially there was some resistance on the part of some clients. They weren't comfortable, doing a video call. From home, and because a lot of times for some of the clients, the stressors are in the home environment, and so it was difficult for them to say, well, I'm going to have my therapy from home because family members are around, there are people listening, how do I ensure that I have this confidential space. So that was a challenge for some clients, for a lot of clients, just ensuring that that space is confidential. I mean, on the part of the clinician, you can ensure that your space is confidential, but on their part, there was no control, kids may be running around, dogs barking. I mean, there are different factors happening, and that made it difficult for some clients to want to consent. But as I said, eventually, clients recognized that they needed to do that. They needed that service because the stressors brought on by the pandemic, worsened whatever condition they were dealing with. And so, there was that increase, and even other family members requested services.
That's incredible as it relates to the patients themselves realizing the need. Yes. And so we have to get over this obstacle. And,
yes.
And then your actual, the amount of patients you have consistently, it hasn't really drastically changed as a result. That's incredible. And how about thank you so much, Ms. Matthews. How about you, Dr. Gordon? The impact, if you could remark on any impact as it relates to the COVID-19, as far as when it started, in that difference in that, what happened with the difference in your, and everything surrounding your care with patients since the start of the pandemic there.
Hi, so I'll say a few things. COVID-19 absolutely changed everything to me in medicine. I want to touch on a couple of things, one personally and professionally. Personally, it was suddenly I trained during the era kind of where AIDS was a major issue. I remember, drawing my first blood draw on like an HIV positive patient. I remember the era, I trained in the era before like all the cocktails were available. So, you see the immune system so bad where you like can see fungus growing on someone's face, like literally that sick. I want to emphasize kind of my background and training was in severe situations with HIV AIDS, right? And so COVID, unlike HIV AIDS, I felt there wasn't protection. I did not feel protected. I did not feel safe. I'm a single mother. And I have other peers who have single parents. And the idea of going to work, you prepared a will. You prepared planning, like if I'm going to die. And that is very, very real and palpable as a clinician, because again, you're going towards the fire, but this time you're going towards the fire with no water, with no mask, no protection or feeling of security. I actually wound up catching COVID, and I was severely sick. I was temperature 104.5 for a good 3 to 4 weeks. Shortness of breath. I still have a cardiac issue post COVID, so it's very, very serious. And honestly, I caught it wearing double mask. I'm still a big fan of N95 mask. It may not be on the politically correct stance, but to me, you shouldn't work without one. I don't. I had to find ways now to find my own. I wound up changing jobs because even in advocating for my team, I'm huge on advocating for my team, that everyone is equally protected and equally covered. It's not okay to let certain people go, or to assume that only the doctors get this or that, only the, not the medical assistants, not, I was huge on advocating for my team. So it changed a lot of things professionally, on my expectations. It changed a lot of things personally on the risk. What risks was I willing to take? How far would I go? So the other thing I was going to say is, it's a huge delay. The other aspect I wanted to touch on is just like as far as equality and equity of healthcare. Yeah, we switched and transitioned to all these telehealth services, but there's a huge population, tremendous population that has lacked access to technology, that did not and do not receive the care. Everything from homeless people to elderly populations who can't work the technology. And so it really, there's still such a huge disparity that was created in this umbrella. And yes, we were affected more, we died more as far as African Americans and brown and Black people, however you want to label it. So for me, it's very eye-opening. And I also, after catching it and living, and living to see today, I did start working in person. It was important to me to be able to connect in our communities. It's important to me to work in rural and urban settings where people will not have care. I worked as independent contractor even with Kaiser. Now, half of their physicians were literally able to stay home. but there's a lot you get in the physical exam, and I'm not going to negate telemedicine at all. But for me, it was important to reach patients where they are, like to actually come in and to be accessible. I think mental health issues, and I'm sure everything is skyrocketing. The anxiety, the stress, the pressure, losing employment, unstable homes financially. So again, COVID to me has changed the game. It really, to me, it wasn't so much COVID as much as it just identified the weaknesses in our health system and the disparities in our nation. It truly emphasized how terrible we are as a country towards brown and black people, because we died the most, we still are suffering the most, we still, like, every reference to diabetes and chronic conditions, we are the ones that are going to be impacted the most. And so again, I hope I'm sorry I'm going on so long, but every aspect of it changed the game. It made me actually very creative in finding. I found N95 masks. I have a good resource, to protect myself and my team. Because again, there's a salary difference. My medical assistant can't buy the same things I can buy. So I was really big on protecting my team, protecting myself, and creating a safe atmosphere where, relatively safe. I created a lot of policies that I will adhere to. And there are places I won't work, and there are places that I won't participate with, and they don't kind of meet me. These are interview questions I ask in advance. But I am seeing patients in person. I am practicing clinical care and doing the best I can to advocate, again, for patients and my team.
And I think that's commendable. I think I'm so sorry to hear about you receiving the actual you getting that COVID-19 infection. But this is what I need. It's important that you're here. It's important that that others hear this. How you're at the front line, and this is serious, and that it actually happens. But thank you so much. How about you, Dr. Austin? Would you want to remark on as far as what's going on with your business and how that has impacted it? I know I saw the head moving a lot, so you can refer back to some things too.
Yes, I too, like Dr. Gordon, I did contract COVID-19 back in May of last year, and I was hospitalized for over a week. And I'm fortunate that I didn't lose my life to COVID, but however, I did lose one of my colleagues. I don't know if you know Philip Rinaldi, who I've known for over 2 decades. He lost his life to COVID, and we just buried him on Monday in the funeral industry. But I have to say, our industry, to me, feels like being on the battlefield when you see all the soldiers who get killed and the bodies just don't stop. And they're still coming. We're still getting them. And I'm telling you, we're doing 2 funerals a day, 7 days a week. And that's not just COVID, but I think some of it has to do with people, like in the nursing homes who are dying of loneliness and isolation. And the COVID impact has disrupted our industry and how we serve the public. The decrease in the attendance for services, having to immediately dispose of deceased individuals through either direct burial or cremation, family members having to identify their loved ones with COVID by photograph or a picture of an ID tag on the body bag. I just can't even fathom the amount of grief that one will endure, for the rest of their lives, not having contact from their loved one from the time they enter the hospital to the grave. We've seen now where we do a lot of international shipping. We can't get bodies out of the country. The airlines won't take them. The airlines are just, have completely shut down in some airlines. So now you have to convince families, to bury here or cremate. And, some of the meetings we do now are Zoom meetings. Then there are some funeral homes that just won't take COVID at all. And their families have to find somewhere, to have their loved ones go because the funeral home said, no, we're not going to have them. I've seen a funeral home where they accidentally got a COVID patient and they called and they said, come and get this body now. We don't want it in our facility. So what do you do? And this is still going on. I don't know if it'll end. I don't know what will happen. But I just know that the other thing is that people don't have monies, because these are some unexpected deaths that people don't have. And luckily FEMA has stepped in and they're going to assist some of the families. But let me just say this, there are caveats to that as well. You know, if you have insurance, trust me, FEMA is not giving you any money. So, but I just want to put it out there that if you have a loved one who's died of COVID and you did not have insurance for that individual, please apply for the money to be reimbursed. I just want to let you know that. But that's how it's disrupted our industry.
Well, thank you so much, Doctor. And again, I'm sorry to hear about your experience with COVID. And I do want to make sure this is definitely clear that despite all of you guys' experiences with COVID-19, you guys are definitely dedicated. And we applaud that. I'm certain that I have others that agree with me with that overwhelmingly. So actually that kind of takes us to that next round here of I think it's a very, very important question. Very important. And you know, I just want to let everyone know too, because these are incredible women up here. So that I know some people have questions, and we're going to get to that part. What you'll do is you just put a Q in front of your question, and then we'll, at the end of this actual discussion, we'll take actually from the floor there, we'll take questions, okay? So I just want to let everybody know that if you put something up and you don't have a response yet, don't worry, just sit tight. So basically, my next question, I think it's a very, very important one. And I know, you know, we have all of these degrees and we have all of this, everything attached to your name, but let's get down to how you got it. And that is key. That's very, very important. Something that should be instilled in every young person as it relates to how do you get through things. And so what I wanted to ask as it relates to that, and I want everyone, if they have experienced it themselves or they know someone who has experienced that. My first question, and I'll go back here to the beginning here, Dr. Washington. I know that many of you are mothers, not just that, but have families, depending on your age. Now you have to take care of your mother or father, and pursued your field of study while that's happening. Can you speak on any challenges or offer advice to other students who want to pursue this avenue, but are reluctant though, because they fear or have concern of the challenges that they will face? Dr. Washington, can you start that?
Yes, I can. Thank you so much for this question, because as it pertains to nursing, it has to be a calling. I don't know how to explain that, because nursing is a calling. This profession, nursing, you have to have a whole lot of heart. Your desire to want to take care of others, you're wanting to make a difference in the life of others. There will be sacrifices. There'll be decisions that need to be made to balance your job, your family, your school. But if you have a passion to be a nurse, you will learn to balance and juggle everything you need to do to survive. You need to take things off your plate to decrease your stress. You don't want to procrastinate. You want to just be a better time manager, ask for help, embrace what you can't control. It is really a rewarding profession. And if it is what you want to do, you will succeed. The reason why I'm saying this, I got my bachelor's of science in nursing when I was not married and had no children. So that was easy. I was able to focus just on me and succeeding. But when I went back for my nurse practitioner, and that was because when I was a nurse, I had so much compassion. I had so much support surrounding me with the doctors, my other colleagues. I just felt inspired all the time. So I was one of those ones that wanted to be challenged, lifelong learner, just wanted to do more on the nursing layer, because there's so many layers in nursing that you can help. And an example of a real life experience is when COVID hit, there were nurses that actually quit. I know nurses that quit. They said, I didn't sign up for this. Okay. But then you had others who made the decision about their career to see patients and to stay away from their families to be safe. They actually stayed at the hospital. They changed their clothes before they went in the house. They took their shoes off. They constantly cleaned more in the house. They educated their family and friends about what COVID is to stop the spread. They even talked about, when the vaccine came about, educating them about don't be afraid to get it. I know we, brown and Black people, have a history of knowing things that have happened in the past that may prevent us from trying vaccines, but just educating, making lifestyle changes to make it work. So we had to balance our morals and ethics. So I thought this was a good question for nursing, because the challenges, my advice to others who want to pursue nursing, it has to be a calling, because it's not a clean job. It's a hard job. It's dedication. It's commitment. It's what you want to do, and just feel happy about the outcome of people being happy about what you've done for them. So that's about it. Just wanted
Thank you
to feel
so much,
inspired.
Dr. West. Thank you so much. And I'm certain that there are students out there going into nursing are in situations, are definitely in situations, even before COVID. So thank you for that, because now I'm not alone, right? So let's see. Dr. Davis. Dr. Davis, could you comment on that same question based on, even if it's not yourself or someone else that you have experienced with dealing with some such sort of situation, a family, your family, or being a mother, taking care of the child or whatever. What can you comment on that as well?
Sure. Thank you for asking. I think I would start by saying at the end of the day, if you complete your education and you reach your goal, you are setting an amazing, amazing model for your children. I am the child of a person who had not finished her degree when she had me. And I can tell the difference between my mother's joy and happiness between before she had finished her education and when she finished it. When I turned 12, she made a decision that she was going to go to college. And she told me, she said, I'm going to beat you out. You're not going to get out before me. And she did. So I say that to say, it is very important that you are a whole human being for your children. So when you look at being a parent and you think about like, well, this is hard and it's time consuming, 4 years flies by really fast. 2 additional years for your master's or other, higher levels of education, it flies by so fast. I've been standing places with people for 8 years and watching them do the same job and knowing that they were just as smart as me and they could do my job all day, but they just hadn't made the decision to use their spare time to further themselves. So it really just is, we all have the same 24 hours in a day. So whether I have children or not, whether I have other responsibilities or not, I still have the same 24 hours. And so it might take you 6 years to do something that someone else can do in 4, but that's okay, because in 6 years, you'll be finished. And in 6 years, your children will be so proud of you. So I think, it's just really worth it to really just do it for yourself. And I think that when your children see you putting yourself first, then they understand how to treat themselves. So I think if you just focus on it from that perspective, it really is very easy to see you are doing it for your kids. It looks like you're doing it for yourself, but at the end of the day, you're really giving them a huge lesson in how to be a woman in the world. And then regarding myself, I did have my oldest daughter when I was a graduate student at Howard. It was hard. It was really hard. There's a level of distress and almost like shame that comes along with making a choice. So you might have your own religious beliefs or values that lead you to choose to have a baby. But I felt like I was 25 years old and I had no reasonable excuse. Like I felt like prior to that, I could justify saying maybe I won't have a child. But I had a degree in chemistry and I was getting ready to graduate graduate school. And so, I knew what birth control was. And I'm just being really honest. I was like, I'm going to have this beautiful baby and we're going to see where life takes us. So I really feel like you have to be like really clear with who you are and what your values are. So then choosing to have her wasn't easy though. It was like a whirlwind of crazy after that. I had professors that were disappointed. Being in the pharmacy field, I had a lot of male professors at the time. I know things have definitely changed in the last 20 years, but it was really hard to see people who you respected be disappointed in your choice. And then family members that weren't happy with my choices. But you know what? At the end of the day, you have to know who you are and be really clear with yourself about where you're going and why you're doing what you're doing. And there are plenty of other women in the world that are here to support you.
Excellent. So thank you so much, Dr. Davis. And so, Ms. Matthews, how about you as it relates to what situations you had to encounter there with family, with I don't if you even if it's not children or if you know someone else that went through that experience as you were going through what you were going through.
Thank you, Dr.
What's that? Yeah.
Thank you, Dr. Downs.
Mhm.
So I'm not a mother. I don't have kids, but I've had several challenges just pursuing my studies. As was indicated in my bio, I started as a medical technologist. I was living on my own and deciding to pursue counseling psychology. It was a big decision for me. And one of my greatest challenges was financial. How was I going to pay for school? Moving from my country to the US, it was a big challenge. And so along that journey, you know, I did not give up on that dream, even though there was major financial challenges. I stuck with it, and I had supportive family members. And one of the things that grounded me as well is my faith. That's one thing that helped me through those difficult and dark days when I didn't know, well, how was I going to pay for the next semester's program? I, prayed through. I had encouragement from friends, mentors that helped me through that difficult process. And so, my encouragement to you out there, even if that's a challenge, don't let it stop you from pursuing that goal. You're not alone because there's always support. Just speak up and look for support, whether it's in your church community, from the school. There are people that are willing to support you through that process. And so don't give up on that goal that you have. One of the things for me as a Christian that motivated me is a scripture that I always reminded myself, Philippians 4:13, I can do all things through Christ who strengthened me. And I kept that message in my head, when those days were dark, when I didn't know I was going to make it through to finish to graduate because I didn't have the money to pay. But, I made it through. And, even though you may be distracted on the path, or you may have had to change your focus at some point. As I said, I started as a medical technology, but I always had that passion to pursue mental health, psychology. I always had that interest. And so don't let anything stop you on that path.
Thank you so much, Ms. Matthews. I just wanted to add to looking what your path was, how many different things before mental health you've done, and that's also related to keeping afloat financially. It's just amazing, all the things that were done. And so, yes, Dr. Austin, how about yourself there? With challenges faced, dealing with things that are outside of you throughout a process of trying to focus on something, and you have to deal with other things.
Yes.
Mm-hmm.
Thank you. So basically, there's two things. I had a small family, but I think what would have helped me if I had had a dedicated partner who could have supported me emotionally and financially while I pursued those goals. And so I truly believe in society that men don't think women should be educated. And, the saying goes that if you educate the mother, you educate the entire household, which I am a true believer in that. And the other challenge for me was that when Dr. Washington spoke about finding the balance between school and spending quality time with your family, and my children in particular, I thought I'd found that balance until my children became adults and they let me know that I did not give them enough time. So, but in the meantime, I did motivate them to continue their education, and they're proud of their mother. So that's where we are.
Look, they my take on that is, I have to say it's very interesting. Sometimes I remark on my parents, and it's the stoic feature of them. Like if I complained about something, it would be what? It's the faces like no, it's just because they went to work, they came home, and stuff needed to be done. I was just happy for that, for the roof, okay. But anyway, so what I wanted to do, because we still have to get to questions here, is basically at the end here. I just want to, just some individual questions based on your particular profession. And after that, we can take questions, okay? I'm sorry, Dr. Gordon, you have a question?
I didn't answer your question.
I'm sorry?
I didn't answer your question.
Oh, I'm so sorry, Dr. Gordon. You better catch me, all right? So, Dr. Gordon, please answer.
Because there's a bad echo. I don't know if everybody's on mute that's not speaking. Because when you were talking just now, it was an echo, really bad echo. So I don't know if everybody's on mute otherwise. Who's not?
Oh, okay. Yeah, that's good too. So I think we're okay for right now. I don't hear any background. So please let me know, Dr. Gordon, please. I'm so sorry.
Okay, so I will say this. I think, and I do understand we're talking to STEM motivated people. I will say that in general, I think in life, you have to have a different drive. And I apologize in advance. My gray hair is telling. But there is a generational changes or differences, right? And I think that oftentimes in this day and age where we want instant Instagram or Facebook or, all these social media platforms, and everybody wants something quick, right? One of the things I do when I talk to young people, when I mentor, is that how much is every year of your life, or every zero you add to the end of your salary, because money speaks volumes sometimes to generate different, depending on generation. Most people listen to green, right? But every zero you want to add to the end of that salary is another degree. So on some level, you have to choose like the gratification now or later. I've been in school a long time. My son asked me once, well, how many years have you been in school? I'm like, well, Lord, I graduated college in 96. That was 4 years of college. I did 2 years of a master's, 4 years of medical school, a year at Jefferson, 4 years at Yale. The years, 3 years at Yale. So 2 years at Morehouse. So the years add up. But I like my salary. Let me say that, okay? I like that I can send my child and not have to worry, to the private school or to, and that's not the only thing. It's not just money. But I do say that to the younger generation, that anything you want, you have to decide and dedicate yourself to. I have a grandmother who was born in the early 1900s. She got her PhD. Her motivation was, and I say this specifically because we're speaking to Black and brown people, the KKK burned down her school in the little country school in South Carolina. She collected the bones of her classmates. She wasn't there that day because her mother was sick. She was one of 12 children, the only girl. She took care of her mother. She collected the bones of her classmates at 6, 7, 8 years old. Can you imagine walking 3-4 miles to school to show up and the thing is burned and everybody you knew dead? And she collected what she could of fragments of bones. And so when I think about life being hard, I don't complain. My grandmother, again, 1906 was born, something like 1900, early 1900s. Went on to get her PhD, and she taught at Benedict College. And she and my grandfather were huge. And I disagree, about me not supporting you. My grandfather supported my grandmother. She got her PhD because of him. He let her leave in South Carolina early. Again, my dad was a little kid. My grandmother went to Temple to get her PhD and came back. I'm a native of Philadelphia later, but anyway. But so to say that I don't believe that all men are against this, but some of them are. I'm a single mom for a reason. But there are some good ones that will support you and will support your dream and your vision. And trust me, if they don't leave, get out. But focus yourself on your vision. Speak to your vision. Speak to your truth. Speak to what you want to claim. I'm a single mother. My child was 18 months, well, I got pregnant in my residency. At 18 months old, I deferred between internship and residency. I went to Yale with an 18-month-old in a predominantly white male environment. If my child was sick, if my babysitter quit, they were like, so why do you have to leave? This case has to go on. So life is going to always move and change in different directions. My son had hearing loss, had surgeries. I mean, life is going to always come at you with some new thing. My dad always says, if you say, oh, this will never happen, that's when it will. You know, so always, I guess, be agile, be focused, dedicated, whatever your vision is. Keep manifesting your vision and keep, some people create vision boards. But whatever you think you want, or whatever you think you want to attain, there's always going to be challenges. There are always going to be adversities you're going to face. But if you are focused on it, my career is so diverse and so broad, not because it was easy, but because sometimes I had to be agile. I didn't plan on getting my master's, but I had to get into medical school. I didn't plan on having my child. But, you have to keep reinventing yourself oftentimes. Even when COVID hit, I had to reinvent my career, find a new job. You have to continue to create ways to manifest your dream. The world is not going to open doors for you. Sometimes you got to push. And the other thing is, and I'm willing to mentor, get mentors. My father told me early on, get 10 mentors in your life. And they don't have to be in your field. Sometimes it's good to have another perspective. But get several mentors and people that you can go to and say, hey, what do you think about this job? Or what do you think about this path? Or what do you think about this? But keep a network that you trust, of professional support, both emotional and emotional friends and support. But always have some level of guidance or people that you can bounce things and ideas off of. But to really be successful in any field, to get all those zeros you want, you have to have the agility, discipline, focus, and just willingness to stay the course. That's it.
Okay. Thank you so much, Dr. Gordon. Thank you. What I'm going to do, I'm going to this next round, and really, if you just do about maybe two or 3 minutes, if we could just answer these questions. It's kind of more specific for your actual profession. And that's for Dr. Washington. Let's come back to you with how has the field of nursing for you changed over the years? If you could just remark on that. It's been so many years you've been in the practice. So.
Right, and I am going to keep it short. Now,
okay.
I know everyone has heard
We're going to fit questions in soon.
Yes, because there's multiple questions within. But I will say that I'm sure everyone has heard of Florence Nightingale. She was our first nursing pioneer. To use the principles and the foundations of nursing. I want to say nursing has evolved from bedside nursing and carrying the bedpans to educators, non-professional to professional. We have nursing education where we have BSNs, Bachelor's of Nursing Science. Then it went to becoming an RN with an associate degree. Why? Because they needed nurses. They needed them. Then it went where we can get MSNs, Masters of Science in Nursing, with a whole lot of specialties and clinical and management administration, things like that. So, we're now coming up on our 200th year of Florence Nightingale's death. And we always do International Nurses Week around May. It's I think the first week of May. So just over the years, advancement of nursing education and evidence-based practice to use evidence to guide our practice. I'll say that because it's a whole lot I can say on that.
Thank you so much, Dr. Washington. Okay, Dr. Davis, as based on what people typically see with a pharmacist, they see the actual, how different is your work that you do every day? How is that different from what typical people see with the pharmacist and the CVS and the Rite Aid and what have you?
Sure. So in any large organization, you need a multidisciplinary team. So I am the pharmacist that sits on the healthcare team for my insurance company. So I'm one of 17 executives, and what I do daily is listen to the challenges and the triumphs of the other executives and support them through their projects. My day-to-day looks like community outreach. I do a great deal of policy development. And then in my bio, you mentioned PBM oversight. So I know that sounds like gibberish. So what that means is the way our benefits are set up, it is my responsibility to make sure they work the way you expect them to. So if you get to the pharmacy and you're supposed to be able to receive an antibiotic and your copay is $0, it's my responsibility to make sure that those things are in place for you, that you're not being charged for things you shouldn't be charged for, and that you have access to everything you should have access to. And I heard someone somewhere today mention money, and at the same time, make sure we're not wasting money to have an efficient healthcare system, because I do happen to work for Medicaid at this time. And one of the things you have to understand is we have to treat medically necessary conditions. So where we have patients who have cancer and it is very, very expensive to treat them, we also have patients who have asthma or psoriasis, and those things are expensive too. So then you got to kind of figure out, how do you balance the system so that you can do the things you have to do, as well as finding a way to do the things that you want to do. So we want to care for everyone. We want to give everyone everything they need, but there are many times when we have to say no. And I feel blessed to be in my position because I am very thoughtful about our community, and I try to make it the most gentle, kindest no that it can be when I do have to say no. Hopefully that answers your question.
Thank you so. Yes, definitely. Thank you, Dr. Davis. Ms. Matthews, I think you've addressed it at a certain length already, but what has technology, how has technology informed how you practice currently? With practice currently right now.
Okay, thank you.
If you can expound upon what you already talked about.
Okay, thank you so much, Dr. Downs. So technology has become a critical part of us in the mental health profession providing services. Without that technology, our services, which traditionally is in person, would have been almost impossible. And so we recognize the value of technology since the pandemic, and it's been used on a wider scale. We're able to reach more clients. But however, technology is not without its limitations. And so there were some challenges that we've had to deal with. But some of the benefits that we found from technology, you don't have to be in the office since it's virtual, because most of the sessions that we do now, since we're restricted, is video calls. And so you don't have to be in an office. And so that reduces the time it takes for you to get to the client. There is that ability to reach more individuals because it's virtual, and you can help more individuals in that way. It is also convenient for some clients. Most people prefer to be in their comfort space, and you're able to reach them. And so it also decreases the possibility of cancellations. When you are doing in person, there is always that risk of the clients canceling at the last moment, but with virtual, it reduces that. Some of the limitations, though, even though we can reach many individuals, sometimes the technology fails us. And so sometimes there is some issue with the Wi-Fi, or there's some technical issue. And so in the middle of you giving services, you may be disrupted. And so your session has to be aborted because of some issues. So that's a challenge that you have to deal with. And another thing, as I have mentioned in the first response, there is that difficulty of controlling the client's environment. You can't ensure that confidentiality. And so that's a difficult piece. And some clients are not able to have that control over their environment. And so there's that risk somebody is listening in, or some other things are going on. And the technology is not also suitable for all clients with mental health conditions. For those that are unstable, you can't do an effective job of meeting their needs if you're unstable through technology, because it decreases your ability to observe the visual and the nonverbal communication, which you would see in an office setting or in a room space. You can't do when you're doing virtual services. So that's a limitation that we also encounter.
Okay, thank you so much, Dr. Matthews, Ms. Matthews. So I just want so for Dr. Gordon, Dr. Gordon, based on your actual experience, how important was training abroad to your practice as a physician? And how might others in STEM benefit from that type of experience?
I'm just realized, please don't post. You posted my email. I didn't want my email posted like that.
Oh, I'm sorry. What's that?
I was just looking at okay. All right. So I think in general, it's very, very good to, it's very good to, in general, just get exposure. Just international. In general, it diversifies. Like the fact that, you know, as far as the panelists even here today shared the fact, she shared the fact that like studying here and studying locally, the cost component. And I don't know if a lot of people know that international students have to pay out of pocket. They can't qualify for our student loan. I don't know if that was even mentioned. So I think in general, having a global perspective of the world is important in life. You know, I say that to children all the time, but and it's one of the reasons I travel. I was fortunate enough to go up home when we were able to travel. And so actually immersing myself in the Cuban culture and Latin culture, I mean, Spanish is a second language in the U.S. So to me, it's important to know it. It's important to understand my patients. Even if you're a translator, and I listen to the translator because I speak Spanish, and I always still call the translator just medical legal stuff, but they always cut off a few words. They always, you know, they don't, you know, always cover some of the little nuances and cultural components that you learn. You know, you really learn what keys. I was in Cuba, but I learned, you know, some of the Mexican cultures. There's certain things that they give children and babies. So when you're treating family members and you're treating the children, you need to know these things. So it's important to know your patient, ask different things. But I just thought it was a great experience. Again, Cuba's been cut off from the U.S. and the point when I went, it was still shut down. It was before Obama. It was very archaic in a lot of ways, like seeing medicine practice in the 1950s. And specifically, I did a lot of pain. I did family medicine, general medicine. But it was interesting to see cupping. I mean, there was so many different creative ways. Again, they have minimal resources. I saw C-sections done with lidocaine. We use lidocaine for a tooth extraction. You imagine that for a C-section, you know? It's like they're bending down. It was a great experience, clinically, professionally, personally. You know, I lived there 3 months and elevators were like non-existent. You know, the little bit I carried my suitcase. I thought I was smart carrying a hard suitcase. I said, oh, traveling internationally. Ha! You're going up and down 5 and 6 flights of stairs with a big old suitcase. And, you know, it was a great experience. I was very blessed. I was fortunate enough to have my parents were both alive, and I was able to take my family and my parents to Cuba recently. So I'm a big fan of Cuban culture and the music and the, you know, Santiago. You know, it was a wonderful experience. Again, personally and culturally and professionally, but I'm a big fan. I even now talk to my teenagers about when he applies to college, just planning on international and abroad studies. It's very important.
Thank you so much, Dr. Gordon. Appreciate that. Dr. Austin, how do you think someone would know if they should consider a career in mortuary science?
Well, let's just say that I think there's an aspect that people are unfamiliar with. They have to realize that people die all the time. And so it's not a 9-to-5 profession. And you have to be able to turn around on a dime. So, you know, you're on call, and, you know, if you're working for an establishment or even have your own business, you know, there's times where you want to go out, have a good time, have a few drinks or whatever, but you have to remember, you know, the phone rings at any hour of the night and you have to be lucid to take that call, right? So you have to think about those things when you enter in this field, because this is a priority. And I think that, you know, mortuary science, the study of mortuary science, for those that are interested in the profession, yes, you work hard for that big paycheck. But the thing about it's like being a doctor, a physician. You have to know the science. individuals cannot get through mortuary science without studying. You have to study because this is comprehensive material. You see it time and time again in the practice. So you have to be able to draw on your experiences like doctors do when they do diagnosis in various patients. Because when you in the industry, you look at the cause of death, and an embalmer has to be able to assess that individual depending on what he died from and what medications they may have been on in the hospital, if they're on IVs. And you have to be able to treat that person because you can have adverse effects from the type of fluids that you use. And people want you to be able to create that natural appearance by the time that funeral comes. And I'll give you a perfect example. With these COVID patients, and they're on ventilators, and they've been in the hospital for weeks and weeks, and they're full of fluid. And so when you get them, you have all this edema you have to deal with, and you have to be able to treat that. You have to be able to know how to get that fluid off of them. And every case is a different case. You can't treat, two cases the same. You have your jaundice cases, and you have to know how to treat jaundice. So people need to understand that, in the mortuary science field, you have to know what you're doing. You have to study. And it's important if you want to, make that money because, your reputation is on the line. The funeral home's reputation is on the line, because, everything is physical. And people come in and they look and the first thing they'll say, well, that didn't look like grandma. That didn't look like granddad. And so that's what I experienced when I was 12 years old. When I went into that funeral home and saw that my grandmother was darker than what she normally should have been, and she was bloated, it's because whoever the embalmer was, he was not a good embalmer, So that's one of the aspects. But then the other thing too, think about, people need to think about is that it is a business. And funeral homes do expect to get paid because there's a lot of overhead involved in running a funeral home. You have people that need to be paid. You have suppliers. You have, your fluid companies. So you have your cars, that have to be maintained. So there is a lot that goes on in the funeral business. That overhead is extremely high. And so, families expect you to be compassionate all the time. But when it comes to the bill, you knew grandma was 99 years old and she was going to die. And then you had no insurance, to pay for her. But then you want me to be compassionate, but you have to understand, this is a business too. So, these are some of the things that we deal with, on a day-to-day basis. But it's a great field. It's a lucrative field, but it is a hardworking field. It demands physical labor, mental, you have to have mental stability to be able to do this job. And especially with the pandemic and you seeing so many people leave this earth. And like me, I've seen a lot of people leaving around my age. It makes me think about my own mortality, so, but like I said, it's a great field. If it weren't, I wouldn't be in it for over 40 years.
Thank you. Thank you so much, Dr. Haas. Appreciate that. So basically what we're going to do is we're going to switch to Q&A now. For students out there, anyone out there who's attending, if you have any questions for the panel, you can just actually put a Q there in the chat box, put a Q first, and then put what your question is. I'll see if I can recognize that, and then what we can do is I'll let you actually ask your question. Okay. So I see our Q now there, and this is from Taylor. Is it possible for Taylor to actually become unmuted to ask the question?
Everyone, absolutely. Let me just go back and make sure that
Okay.
I'm reading it correctly, because I think I put at least 2 questions in the chat. So I just want to say thank you, ladies, as well. You are absolutely inspiring, because as a student, especially now with the current climate, I don't know. I'm tired. But classes are going. I'm taking 18 credits right now because I want to knock it out, but at the same time, mental health is really, really important. So I just appreciate this experience right now. You all are very inspiring. I'm definitely encouraged to get all my work done right now. But thank you so much for just being here and talking to us as Black women. So my first question was, what would you say to someone weighing the possibility of opening their own practice in health as opposed to working for an established company? I know that personally, I feel that I want to open up my own practice eventually. My current field of study is psychology. I'm super interested in neuroscience. So I hope to kind of combine that with nutrition, with environmental sustainability eventually. So I'm really just trying to figure out, also with health policy, I'm like all over the place. I want to save the world, but I'm really just trying to gear and just focus down. So what would you say to someone who is kind of trying to figure that out? Anyone?
Okay,
I'd like to take a stab at it because I saw it in the chat and I started thinking about you. So I would start with, what is your why? You have to be really clear, and you need to be able to write like 2 pages on this why. Like, it can't just be because I want to help people. You have to get real, like, narrow and focused on your why. I would also think about, are you talented or are you business minded? Because if you are talented, then you need to work for someone who is business minded. If you're business minded, then you could potentially do it all. But you have to understand that opening a business is not just my vision, my concept, do it my way. It's HR, it's payroll, it's, what happens when people call out, what are the state laws regarding FMLA. So it's so much more than just, hey, I'm doing it my way. Because you could partner with a business-minded person and it could be your vision. And it doesn't necessarily have to be everything on you. And it doesn't, neither answer is right or wrong. It's just something you absolutely have to consider, And then the other last part I would say is really work out the financials, because I think a lot of people want to go into business, but they really do not understand that they will not necessarily make as much money as they think they're going to make. I know I speak to pharmacy owners like every other day telling me they're not making any money. And I'm like, well, if you did the math and you looked at the contract you signed and you see how much money we're paying you to provide this service, then you could see that you're not going to make any money. I mean, it's unfortunate because it sounds like even being I do real estate. I don't do real estate. I own a rental property. I have someone who lives in my property, right? There was years when that property didn't make any money. So I think you just have to be really focused about what is your why and really take the time to work out the financials. If you don't have the capacity, not that you're not smart, but literally the time and inclination capacity to work out the financials, that's your answer right there. Because a business-minded person is going to sit down and they're going to know every single dime. And they will know where their money is all the time. They will also be able to develop a team behind them to back them up to manage those financials. I'm done.
Okay.
I was going to add to it also. I agree absolutely 100% with everything you just stated. And a lot of times, I just think it's important, especially if you're a student now, to develop your craft, because there is a lot that you benefit from working with others and working with peers and mentors and people that have been doing this for 40 years or 30 years. And there's so many nuances, especially if it's a medical or health service field, even how you bill, all those things and nuances. I am not a fan of just jumping out of it as a newbie and it's like a newborn baby just running a marathon. We got to train. You have to develop some level of skill to kind of be in position for success. So I'm big on, again, find mentors, talk to them, and really strategize the evolution of your career, including if you open one day. And I agree with her, because I'm not a business-minded person. I had a rental property, and guess what? My renters didn't pay, and I lost money. So she's a business-minded person. It wasn't good for me. She's absolutely right. So I'll shut up.
Thank you guys so much. I think there is, and I don't know if that was another question that you had, Taylor.
I had another question. Again, I feel like I'm super. Thank you for those answers. That absolutely answer my question as well. I am like probably 25 to 30% business minded. So maybe that's something that I need to reconsider. But then again, who knows who I might become in the next 10 years of school that I have to sit through. So we will see. But thank you so much. That truly helped. My second question was just as far as just retaining all this information consistently like this. I take all science classes right now, and they're all medical terms: anatomy, physiology, all the ologies, and all this stuff. So are there any tactics or things that you could suggest that would just help with retaining information and just helping with studying? Because this is going to be nonstop. I'm taking semesters, all 4 semesters each year, and again, I'm maxing out my credits because I want to get it done, but I also just want to apply myself now. So are there any like tips or tricks? Thanks.
Yes. I don't know who wants this one or
Whoever wants to take, who wants to take
I
this
was
one?
gonna say, for me, I think medicine is not a test of health. Medicine for me is a test of how fast you can retain information. They have something on Netflix called some series, and they deal with the mind and memory. There are people who are like phenomenal at memorizing things, and there are different memory strategies, right? But the other thing I would say is I don't know if it's smart or the best strategy for you. And again, I know my email was posted. I'm definitely willing. Somebody asked, "Are you willing to be mentors?" Yes. So I would say you really have to look at yourself as an individual. I did not do well in medical school trying to manage life, right? I isolated myself, and I was in a bubble for a good 4 years. My family didn't see me. My mother saw me once, said, "Oh my God, you're too skinny." So it depends on you. You have to know yourself and your strengths. And to me, it sounds like you might have too many credits, even listening to how you're talking now. That there's no rush. It may seem like important to you to finish in 4 years and XYZ, but it matters to come out mentally strong, mentally focused, and able to tackle the next stage. Because trust me, entering the workforce is not easier. You're gonna have some angry people you deal with, and happy people, and miserable people. All gamuts when you enter the professional work world. So I don't know if it sounds like 18 credits is and all the ologies is the best strategy, right? And I don't know your life and your life circumstances, and I'm not asking you to share that now, but I think it's important to look at the holistic approach, how you study. In grad school, I had straight A's, but I had to. In medical school, I had to have straight A's to get into Yale. So it doesn't mean that I was perfect or ideal, but I learned myself, and I learned how I retain information. My son is completely different than I am. He's smarter than me, I say all the time, but his strategy for research, for studying, is very different than mine. And I think, again, one-on-one, please contact me if you want to talk about your study approaches, but memorization is key. And how fast you retain information is in the health sciences, to me, is half of the battle.
Excellent. Thank you so much. There's another question here.
Oh, Dr. Downs, I'd like to add to what Dr. Gordon said.
Okay, good. Mm-hmm.
Okay. Rote memory, ROTE, rote memory really doesn't work in nursing. You have to be able to understand and utilize critical thinking like constantly. So the most successful students are like the ones who really commit to doing the work. Work in groups. When you work in groups, you tend to talk about different processes or the things that you're learning. You can let it simmer and really understand it. Because in my field, there's really no cutting corners in nursing or really healthcare without bad consequences. So, my recommendation to you is that, I'm not sure about your workload. We all took kind of courses that were difficult, but really trying to understand it and work with others that can help you understand it will be my recommendation for you. Thank you.
Thank you, Dr. Washington.
I also have a, I'm sorry. I also have a comment, because I think it was a great question that she asked. And I think that's the whole point, is each of us is having a different experience. So the way my brain works, I need to understand things. So I'm a chemist. So it needs to all go together to me. So I did poorly in biology because I don't memorize. But what I have learned over time is, like, I'm a chemist, I'm a physicist, those things make sense to me because I can see it in the air when it's happening. But if you tell me that this bone is just that, I'm like, okay. I have to kind of really, really work hard to make my brain remember that, because my brain just doesn't do that. And that's okay. Each different kind of person can still be successful in healthcare. But I really feel like you just have to find an assessment, an actual assessment of your learning style. So when you connect with your mentor, whether it's Dr. Gordon or someone else, one of the first things you have to do is get really clear about your learning style, so that you can then look at the study techniques that match up with your learning style and then you'll be able to move forward. But until you, like she said, really assess yourself to see what style works for you, you will kind of bounce around and it will feel kind of crazy. And I agree with her, 18 credits sounds really, 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 really hard. And we all hope, you know, that it works out and that you can do it. I don't want to discourage you at all, but I have never been able to get through 18 credits, and I'm being very transparent with you so that you don't feel overwhelmed like it's required of you to do so much. I think that's it. Thank you.
Oh, no, thank you. And thank you so much, Taylor. Appreciate that. I hope that helps.
One last question, and if
one last question. Okay, so it looks like after Liliana Asensio, are you there? You can unmute.
Hi everyone. Thank you so much again. It's been so wonderful hearing from you all. And so one thing I wanted to ask you all is, if you work as an individual practitioner more one-on-one, how do you work towards impacting systemic change? And if not, if you're more working on a systematic level or a systemic level, do you miss that kind of individual one-on-one care, or how do you focus on giving back to the community as well?
Thank you so much, Liliana. Is there a panelist that wants to take that? Okay.
Don't forget anybody one thing at all. If you can find ways, I can always stop them, right?
I think that maybe if everyone mutes while Dr. Gordon talks, maybe that's going to help. Okay.
I say do multiple things. I've worked at corporate settings. I've worked with insurance companies, similar to our panelists. But I just think it's important to balance your strengths and your weaknesses. It's really a lot of self-awareness as you grow it professionally and in your career mode. You really have to identify where you're strongest. You know, I love the beginning when the panelists say, you know, like emotional awareness and strength and communicating and the art of listening. You know, I loved everything she said, because I also realized for myself, I'm not always the best person in the room to speak to certain things. You know, I'm not necessarily politically correct. So I like direct patient care. I like influencing. You can affect a community working at a community health center. You can affect a community right now as a panelist. I just think if you create and manifest your vision and opportunities that come your way, again, agility, being agile and navigating different ways. You know, if it's a support group you wanted to help create, if it's however, all the different ways that life will hit you, you know, you'll find ways from your child's school to, it's always different avenues and ways. It may not always be monetary, you know, but you can create ways that you can impact. You could be a sit on a board or a committee for, you know, a health facility. It's so many ways that are not necessarily documented in a resume or on a, you know, LinkedIn website, but it's always to create and manifest vision for the community. And so I kind of done both, basically, community as well as for the community directly or on the population health side. You know, you can impact whatever your vision is, however you manifest it. I like when somebody says why. When you know what you want to do, you can do multiple roles. You got a whole lot of days, 7-day week, hours. So.
Thank you so much, Dr. Gordon. We're coming real close now to the end, so we don't want to push it over 1 o'clock. I'm so sorry about the questions that we can't answer here.
We have one last, I'm sorry, we have
one last.
Yeah, but for 1 minute, we need a 1 minute answer and then we can end. I think the only question remaining now is from Nicola Robertson. Have you attended that question?
We can speak. Okay, Nicola.
Who is Nicola Robertson? Please say a question, and that's the final.
Yeah. Hold on real quick, because I got to drive.
Nicola Robinson? Okay. I'm not sure if she's still they're still there.
Okay.
Yeah. I just wanted to make note that as I can see through the chat, I agree with the statements made about how aspirational this conversation has been. I hope you guys enjoyed. Please become assiduous and remain diligent. as it relates to pursuing whatever you have to do. Don't get swayed in any way, please. And I'm actually inspired. So I hope you guys basically come from this and continue on. And that's the major piece here. Let's go ahead and do a closing here with Dr. Saeed. We'll first start with the incredible and incomparable Dean Hamilton. She'll say some closing remarks here. Thank you so much. Dean Hamilton. I don't know if she can hear.
I have to unmute.
Okay, there you go.
Maybe one of these scientists on here will come up with an app that can, as soon as the person starts speaking, the thing unmutes. But anyway, what you didn't hear me say, Dr. Downs, is that I thank you for this, for always introducing me so eloquently. I don't know what my kindergarten teachers would say of me, but that, you're right there, and that check keeps getting bigger and bigger. One of these days, I'll send it to you. But I'm really, really excited and always to be a part of these forums. It's been, this every year. I know I say the same thing. It keeps getting better and better, and I really want to thank all of those who have worked to make this a huge success. I know Dr. Saeed is going to recognize each of you individually, but I just want to add my 2 cents to saying that it's wonderful. But when we first started doing this, I knew that there was no stopping us because this is a big need. There are few women that are in the STEM disciplines, and there are fewer women of color. I've put 2 research articles in the chat. Hopefully you'll get a chance to look at it, and it will show that that exactly what I'm talking about. So for Asian women, they're 5% are in the field, in a STEM field. For Black women, it's 2.9%. And for Latinas, it's 3.8%. So we've got to do something about this to make a difference in this. So hopefully you've learned a lot from listening to these very accomplished female scientists who are on the panel. And it will encourage you to join one of these disciplines. I know sometimes the way it works sometimes is that people express an interest in STEM, and then they are dissuaded because they can't do as much math, or they're afraid for different reasons. But it is cool to be interested in STEM, and I hope that once again that you all were inspired by the presenters. We want everybody to be interested in STEM, but specifically females to be interested in STEM. So I'm going to turn it over to Dr. Saeed and thank her for leading this effort as well.
Thank you so much. First of all, I'd like to thank the panel, Dr. Austin, Dr. Mccrary, Dr. Gordon, Dr. Matthews, Dr. Davis, Dr. Washington. You guys were, wow, so motivational, so inspirational. I mean, I'm sure the students could resonate some of the life stories. I mean, it was very nice and motivational. And I hope that I have shared your emails addresses on this chat. This chat is not going to be linked on Facebook, right? So your emails are protected. I did not get permission for that, but yes, but the students would keep emailing me privately, and the technicians, that they needed your contact information. Students will be in contact with you, and we hope that you will continue being an inspirational or mentor figure for our students, because I have seen some tears in these words that I'm getting. I mean, I'm getting a lot of private messages that students really were inspired in the last 2-hour session. This event keeps growing. Like the dean says, every year we had a 172 limit. I mean, it's excellent. People are watching us, people are looking at us, and we are looking forward towards your continued support. But let me I'm not good at saying out all names, but I want to really thank Dr. Damon Downs. I would like to thank him for his enormous efforts in getting this the panel together, getting synchronizing this event. There's a lot of behind the scenes works that are involved. So thank you, Dr. Damon Downs. Thank you to Dr. Mccrary for his continued support towards the STEM fields. The last 2-3 years that he's been here, he has been really helping us a lot. I really like to thank Dr. Mccrary. My right-hand man, I always say he's my right hand, Dr. Naseem Yusuf. I say he's my right hand and my left-hand man because he a lot of behind-the-scene works. His name is not there, but he has really helped the division, the department, me, everyone. Dr. Naseem Yusuf, thank you so much to him. Dr. Palash, my brother. Dr. Palash, I call him my brother. I mean, excellent. Thank you so much for the support you have given Dr. Palash, because these are names which are not published, but they have done equal amount of work or even more. I mean, excellent, Dr. Palash, Dr. Downs, and Dr. Yusuf. These three men are the full-time faculty of the life sciences, and they're supporting the women. I mean, it's excellent. I'm so proud of them. Thank you so much. Of course, Jay Morrow for preparing the flyers, for the technical support. Jay, you've been great to us. Every time you've been great. Thank you so much, Jay. Miss Denise Slaughter, thank you so much. Dr. Hamilton, wow, our superwoman. She is my mentor. Dr. Hamilton is the Dean of Academic Affairs, and wow, I don't have words to express that, how much she has supported the woman in STEM fields. Dean Hacker has really supported the STEM programs a lot. Thank you, Dean Hacker. Miss Laverne Gooding-Jones, thank you so much for your, if you're here, if you're not, thank you so much for your support. Dr. Murphy, Dr. Rogers, Dr. Akwaka, Dr. Aika, and Dr. Susie Kato. Thank you so much for all your support every time. I mean, you guys are always pushing, we're always supporting each other. Thank you so much, Dr. Rogers, Dr. Akwaka, Dr. Aika, Dr. Murphy, Dr. Kato. And of course, all those who I have not mentioned. I mean, I cannot say the whole list, but I mean, Dr. Austin, Dr. Angel King, you have come to the mortuary science programs and you have really revolutionized the program in a short while. Dr. Austin, you have done a very good role. I'm sure Angel King, she's listening to me, Professor King. Thank you so much. And Dr. Taylor, I mean, I can just go on and on, but this is all a team effort. The students need you. The students need to hear from each other. The students need support. Faculty need support. We need each other's support, right? For STEM fields, we are going to support each other. I really would like that the panelists, we stay in touch with our students. If you'd like to volunteer on any other events, you can send me private messages and I will give you some opportunities to come and give guest lectures to our students. We have a career day coming up on April 1st. If anyone wants to contribute in that, please send me a private message. And the students, my lovely students, wow. Thank you so much that you stayed on for 2 hours, more than that. Some students logged in at 10:30. To the students, wow, this is for you. We are doing this for you to keep you inspired and motivated into STEM fields, right? And your families and your colleagues and your community. Please share this information that women rock in STEM, right? Thank you so much. Thank you so much, guys. Thank you. Dr. Downs, anything else?
That's it. Thank you so much, guys. That's it. That concludes this forum, and see you next year. All right. All right.